Hello, I'm Tony DeMaria, the editor of Jack, here with another edition of Inside Jack and talking about our latest issue that's posting today, and there's some really interesting articles in there. Our state-of-the-art article deals with tricuspid regurgitation, written by Dr. Alfieri and his colleagues, and it's now appreciated that functional tricuspid regurgitation is not as benign as we always thought it was, and in fact it has significant prognostic value. It's clear that functional TR does not always resolve in a major way after resolution of the left-sided lesions when that's prevalent. And indeed, Dr. Alfieri and his colleagues argue that perhaps we should have a more aggressive approach to repair of tricuspid regurgitation, even when it's functional. It raises some interesting points. In terms of interventional cardiology, there's a very interesting article that deals with chronic total occlusions and how the vascular system behaves following PCI. And what was observed is that following PCI with a drug-eluting stent of a chronic total occlusion, that in fact there's endothelial dysfunction. And this endothelial dysfunction is present acutely, but seems to relieve over time, because over a period of time the distal vessel dilates, and IVA study shows the dilation is not due to positive remodeling, but in fact due to increase in the lumen. So this has implications regarding vascular behavior and physiology following a total coronary occlusion, and also in sizing stents, because if the stent is sized based on the distal vessel early on, then in fact it may be a bit undersized as the distal vessel will dilate. Now, in terms of electrophysiology, there's a very interesting article on patients who have heart failure with an indication for biventricular pacing, cardiac resynchronization, but who are in atrial fibrillation. And the question is, what is the best way to treat these patients? Is it with rate control, or as an option, should they undergo AV nodal ablation and then biventricular pacing? And in fact, the results of this study suggest that AV nodal ablation is the superior pathway, that heart failure patients in atrial fib who need CRT, cardiac resynchronization, do better with AV nodal ablation and pacing with CRT than they do with rate control alone. This needs to be verified in a larger study, but very interesting information. There's also data on cardiac imaging and the value of delayed enhancement scar identification by MRI as a prognostic marker post-infarction, and some very interesting clinical research on a biomatrix constructed of a hydrogel from ventricular extracellular material. So lots and lots of good information in this latest edition of Jack. For Inside Jack, I'm Tony DeMaria.